Okay, mamas, today we are going to finish up our topic on tongue tie. And we're going to talk about the process of having the tongue tie revised and how a chiropractor is a vital role in that process, why you need a chiropractor before and after if you decide to have that tongue tie released. So there are two ways that we can treat a tongue tie in an infant. We can do a wait and see. We don't have to do it right away or at all. And that's a choice that your family has to make. If you decide that you want to have this tongue tie, it's been diagnosed and you want to have it revised, your option is to go to a pediatric dentist or even an ENT, and you can have that tongue tie revised. A lot of ENTs will use a scalpel method, some scissors or a scalpel, which is called a frenotomy. And then if you go to a lot of the pediatric dentists, they do a frenectomy, which is using a CO2 laser. And that does have a lot faster healing. It's more precise. And usually they can do lip and tongue at the same time when they're using that CO2 laser. When they're using actually scissors, they try to just do one or the other and kind of see how they do. The most important decision you can make when you're thinking about doing this is the optimal timing. It's not something we want to jump right into, and I'll explain that. We need to make sure that the body is relaxed and it's ready to heal, and that the mouth is ready to have the procedure done. So it's something that, a lot of times we need a couple weeks to work on the body tissue before we have the release done. So the timing is optimal. A lot of times working with lactation and obviously a pediatric chiropractor, we can really make sure that the timing is just right for that little baby to have it done. So why is chiropractic important before the procedure? So that small membrane on the bottom of your tongue connects all the way down to your big toe. It's connected through fascial lines. So when we have a tongue tie and we're tight in our tongue, we can actually be tight all the way through our body. The tongue is very complex. It is an organ made of 8 muscles, and they're involved in feeding, breathing, speaking, speech, posture, and other functions. So the tongue is super, super important, and it affects so many different things that happen throughout the body. So what we do as a pediatric chiropractor, we use gentle chiropractic care and what we call cranial sacral therapy to help reduce the tension in the jaw and in the mouth and through the entire body before the procedure is done. So a lot of times babies are using accessory muscles when they're trying to suck and they have a tongue tie. They're using muscles in the neck, muscles in the upper back. And so a lot of times those get really, really tight, and babies have a really tough time when they're trying to rotate their head or when they're trying to latch and suck when they have a tongue tie. They're just trying to use other muscles and incorporate them. So we help to loosen the tongue, the teeth, and the jaw. So we do a lot of work in the mouth before the procedure. We want to try to work through the stretches before the procedure is done, so the baby kind of knows what to expect, and also for mom and dad, so they understand, like, okay, this is what you're going to be doing a few times a day. And we want to get baby used to having people's hands in their mouth. The tongue is also, it has muscle memory, and it needs to be retrained to do the proper movements to allow to nurse properly. So let's say when you were born, you decided you wanted to, learn how to run. So we're going to put a pair of shoes on you, but we're going to tie the laces. And that's all you've ever known, is to have running shoes on with tied laces. So you're running around the track and you're getting there, but it just takes you a lot longer and you struggle. So we decide we're going to release the laces, and you're going to have, no ties in your laces. You can run around the track a lot faster, but you really don't know what to do. Everything's really confusing. So it takes a long time afterwards for the baby to be retrained. And so we work on some of these fundamental things before the procedure even happens. And then we can then have the procedure and work through with mom and dad afterwards. So usually we like to have at least 2 to 3 weeks before the procedure is done, if we have that time, if the baby's not struggling so much and losing weight. So why is it important afterwards? Well, the same things. We're continuing to work on the tight fascia through the body. We do all full body work on baby pre and post procedure. We also show the parents the stretches again and make sure they're doing them right. We're checking the baby, we're checking the incisions to make sure that they're not readhesing, and we're trying to do some more stretching and oral work on the baby when they're in our office. We're working on those accessory muscles. We're trying to prevent that torticollis or treat that torticollis where the baby's neck is really locked up in one position. We want to support the mom, especially encourage her through this process because baby's retrying how to nurse, and that can take a few weeks, and that can be really frustrating on moms. So we're really trying to help her through the nursing troubles and encourage her and make sure that baby is gaining weight and continuing to improve with some good suck function as they're healing. So we also want to relax their nervous system. Pre and post revision, these babies are stressed out. They are tired, they are frustrated, they are angry, they're learning a lot of new things, and so their nervous system gets super stressed. We can check that with our insight scans before and after the procedure to let us know that baby is a lot less stressed and doing better. But with our gentle adjustments, we do help relax their nervous system, which can just help baby calm down and not be so fussy all the time. We'd like to see the baby about 4 to 6 weeks after the revision. It takes about 4 weeks for the tongue to heal, sometimes up to 6. So we work through the baby's fascia and their whole body through that whole procedure. Most of the times that we notice the baby is a lot more content, they're nursing better, they go back for their post-op visit, and they're doing amazing because they're having all of this body work with their pediatric chiropractor or craniosacral therapist. In our office, you get a little bit of everything. We do craniosacral work, and we actually do the body work too while we're adjusting the baby. So you want to make sure you're seeing the correct chiropractor, a good lactation consultant who specializes in tongue and lip tie, and then a good pediatric dentist that does a lot of these all the time. Our office has a lot of resources for these people locally, so if you guys need help, please reach out to us. We would be happy to connect you to one of these other professionals. But we work as a team, and it's just so great to see what happens with these babies with a short amount of time when they're working with lactation and a pediatric chiropractor and a pediatric dentist. And so just make sure they're whoever you see is seeing a lot of these babies and they're specialized in it and they're very confident with their work because it is a special technique, and it's something that those of us that do it all the time work really, really hard to make sure these babies are comfortable and we can do the right procedures on them at the right time. So if you guys have any questions, or you know a mama who's maybe struggling or thinks their baby has a tie, reach out to us. We would be happy to evaluate them in our office if you're local. If you're not local, we'll be happy to get you someone close by that would be able to help. You can reach us on Instagram, you can reach us on Facebook or our YouTube channel, or just call the office and we'd be happy to help. Have a great day.